Welcome to today's Careplan training. By the end of this training, you'll be able to identify a patient problem at admission, initiate a care plan at admission, update and individualize care plans during the patient's stay, resolve care plans. For the new care plan process, you will not be using the care plans that you're currently using today. Care plans will now be in assessment and flow sheets. Also, this new care plan process will only apply to the following units: ICU, telemetry PCU, med-surg, surgical, and hemodialysis. All other units will undergo a new care plan process at a later time. So you need to continue your current care planning process. The new admission documentation process is going to change. For you to document an admission efficiently, you need to follow the following steps. First, a general admission needs to be completed. Once a general admission is completed, there will be a trigger that will automatically open the nursing care plans assessment. At the end of general admission, you will find a question, initiate nursing care plans. There will only be one answer to this question. You would click on the answer and then click Submit Next. Afterwards, you need to put your signature, hit Submit, and the nursing care plans should appear afterwards. For each review of systems, you must choose a care plan that's applicable to your patient. To do this, you would click the small square box. If the care plans don't apply to your patient, you would choose Not Applicable and hit Submit. If there's a nursing diagnosis that is applicable to your patient, you would choose that and click Submit. For status, you would either choose Active, Inactive, or Resolved. For active care plans, choose the Active button. For inactive care plans or care plans that are not applicable, you would choose Inactive. If you're going to resolve this care plan for this patient, you would choose Resolved. You must also choose Initiated Date of the care plan. You must type in the related to and/or other problem. You must choose a desired outcome and interventions that are applicable to your care plan. If you choose to add additional care plans that you can type in, you would choose yes. The screen will refresh and then it will add additional fields for you to type in interventions. Otherwise, you would choose no. You must choose a target date of completion of goal. You can also choose to continue or resolve this care plan. To resolve a care plan, you would choose no. The screen will refresh and it will give you choices for reasons to resolve a care plan. Otherwise, you would choose yes. For shift activities done to help patient accomplish desired outcome, you must type in something that you did during the shift that's in regards to this care plan. For reviewed and updated this care plan, you would choose yes. If you need another care plan in this review of system, you would choose yes. The screen will refresh and you have another care plan section that you can add another nursing diagnosis to. Otherwise, you would choose no. And those choices will not be there. For this dialysis assessment, the dialysis nurses will be completing this in their shift assessment. After you complete the nursing care plan assessment, the interdisciplinary plan of care revised assessment is going to be automatically triggered from your nursing care plans assessment. There will be a change on what interdisciplinary plan of care assessment you're going to use. Adult units will use interdisciplinary plan of care revised, and the maternal child health units will use MCH interdisciplinary plan of care. In your interdisciplinary plan of care assessment, you're going to find that under nursing care plans, that the care plans that you did under the nursing care plans assessment are pulled in. So you will no longer need to type in the nursing diagnosis or the interventions for your care plan under the IPC. After that is completed, you can also go down and complete your discharge planning interventions and then hit submit and complete your interdisciplinary plan of care. Just to review the new admission documentation process, first, you would complete the general admission. Second, you would complete the nursing care plans assessment that is triggered from your general admission. After you complete the nursing care plan assessment, then the interdisciplinary plan of care assessment is going to be triggered. After that, you would initiate an adult initial discharge assessment. How to update your care plans during your shift assessment. So, in your shift assessment, the nursing care plans are embedded within the review systems in your shift assessments. So as you're answering your shift assessment questions, on the bottom of each system, you're going to find the care plans that were completed through the general admission and interdisciplinary plan of care. All the data that was inputted in is going to pull forward into your shift assessments. So your job for your care plans in the shift assessments is to update them and individualize them for the care that you're giving during your shift. So for each care plan that you have marked active in each system, you must comment on the shift activities done to help patient accomplish desired outcome. This is also applicable to the nurses in the dialysis units. So these care plans will be pulled into your shift assessments as well. To initiate a new care plan in case your patient's condition changes, you can go to that particular system and mark the care plan active and proceed to answer all of the questions underneath.